Gastritis is a medical condition that occurs when the lining of the stomach becomes inflamed. It can be caused by a variety of factors, including bacterial infections, excessive alcohol consumption, prolonged use of nonsteroidal anti-inflammatory drugs, NSAIDs, and stress. The symptoms of gastritis can vary depending on the severity of the inflammation, but common symptoms include nausea, vomiting, abdominal pain, bloating, and loss of appetite. In some cases, gastritis can lead to more serious complications such as ulcers, bleeding, and even stomach cancer. There are several types of gastritis, including acute gastritis, which is a sudden onset of inflammation that typically resolves within a few days, and chronic gastritis, which is a long-term condition that can lead to permanent damage to the stomach lining. Diagnosis of gastritis typically involves a physical exam, medical history review, and various tests such as blood tests, stool tests, and endoscopy. Treatment for gastritis usually involves addressing the underlying cause, such as discontinuing NSAID use or treating a bacterial infection with antibiotics. Lifestyle changes such as reducing alcohol consumption and avoiding spicy or acidic foods may also be recommended. In conclusion, gastritis is a common medical condition that can cause discomfort and potentially serious complications if left untreated. Early diagnosis and treatment are important for managing symptoms and preventing long-term damage to the stomach lining. Gastritis is a medical condition that is characterized by inflammation of the stomach lining. This inflammation can be caused by a variety of factors, including bacterial infections, excessive alcohol consumption, prolonged use of nonsteroidal anti-inflammatory drugs, NSAIDs, and stress. One of the primary causes of gastritis is a bacterial infection known as Helicobacter pylori, H. pylori. This bacterium is commonly found in the stomach and can cause inflammation and damage to the stomach lining. H. pylori infection is a common cause of chronic gastritis and can lead to the development of peptic ulcers and stomach cancer. Excessive alcohol consumption is another common cause of gastritis. Alcohol irritates the stomach lining and can cause inflammation, leading to gastritis. Chronic alcohol abuse can also lead to the development of peptic ulcers and increase the risk of stomach cancer. Prolonged use of NSAIDs, such as aspirin and ibuprofen, can also cause gastritis. These medications can irritate the stomach lining and cause inflammation, leading to gastritis. Long-term use of NSAIDs can also increase the risk of developing peptic ulcers and stomach bleeding. Stress is another factor that can contribute to the development of gastritis. Chronic stress can lead to increased levels of stomach acid, which can irritate the stomach lining and cause inflammation. Stress can also weaken the immune system, making it more difficult for the body to fight off infections like H. pylori. In conclusion, gastritis can be caused by a variety of factors, including bacterial infections, excessive alcohol consumption, prolonged use of NSAIDs, and stress. Understanding the underlying cause of gastritis is important for effective treatment and prevention of complications like peptic ulcers and stomach cancer. 1. Oatmeal. Oatmeal is a great food for gastritis because it is high in fiber, which helps to regulate digestion and reduce inflammation in the stomach lining. It also contains antioxidants that can help to protect the stomach from damage caused by free radicals. 2. is a natural anti-inflammatory that can help to reduce inflammation in the stomach lining. It also helps to stimulate digestion and reduce nausea, which are common symptoms of gastritis. 3. Leafy greens. Leafy greens like spinach, kale, and collard greens are high in vitamins and minerals that can help to support the health of the stomach lining. They are also rich in antioxidants that can help to protect the stomach from damage. 4. Lean protein. Lean protein sources like chicken, fish, and tofu are easy to digest and can help to reduce inflammation in the stomach. They also provide essential nutrients that are important for overall health. 5. Fermented foods. Fermented foods like yogurt, kefir, and sauerkraut contain beneficial bacteria that can help to improve digestion and reduce inflammation in the stomach. They also help to support a healthy immune system. 1. Spicy foods. Spicy foods can irritate the lining of the stomach and cause inflammation, leading to discomfort and pain. Capsaicin, the compound that gives spicy foods their heat, can also increase acid production in the stomach, exacerbating symptoms of gastritis. 2. Alcohol. Alcohol can irritate the stomach lining and increase acid production, leading to inflammation and pain. It can also weaken the stomach's protective lining, making it more susceptible to damage from other irritants. 3. Fried foods. Fried foods are high in fat and can be difficult for the stomach to digest, leading to discomfort and inflammation. They can also increase the production of acid in the stomach, exacerbating symptoms of gastritis. 4. Citrus fruits. Citrus fruits are highly acidic and can irritate the stomach lining, leading to inflammation and discomfort. They can also increase the production of acid in the stomach, exacerbating symptoms of gastritis. 5. Coffee. Coffee is highly acidic and can irritate the stomach lining, leading to inflammation and discomfort. Caffeine can also increase the production of acid in the stomach, exacerbating symptoms of gastritis. Gastritis is a condition that occurs when the lining of the stomach becomes inflamed or irritated. It can cause symptoms such as abdominal pain, bloating, nausea, and vomiting. While there are several factors that can contribute to the development of gastritis, there are also several steps you can take to prevent it. 1. Limit your intake of alcohol. Alcohol can irritate the lining of the stomach and increase the risk of developing gastritis. It is important to limit your intake of alcohol or avoid it altogether. 2. Avoid smoking. Smoking can also irritate the lining of the stomach and increase the risk of developing gastritis. Quitting smoking can help reduce your risk. 3. Avoid nonsteroidal anti-inflammatory drugs, NSAIDs. NSAIDs such as aspirin, ibuprofen, and naproxen can irritate the lining of the stomach and increase the risk of developing gastritis. If you need to take these medications, be sure to take them with food and only use them as directed. 4. development of gastritis. It is important to find ways to manage stress, such as exercise, meditation, or therapy. 5. Eat a healthy diet. A healthy diet can help prevent gastritis by reducing inflammation in the body. Be sure to eat plenty of fruits, vegetables, whole grains, and lean protein. 6. Avoid spicy and acidic foods. Spicy and acidic foods can irritate the lining of the stomach and increase the risk of developing gastritis. It is important to avoid these types of foods if you are prone to gastritis. 7. Practice good hygiene. Good hygiene can help prevent the spread of H. pylori, a bacteria that can cause gastritis. Be sure to wash your hands regularly and avoid sharing utensils or food with others. By following these steps, you can help prevent the development of gastritis and maintain a healthy digestive system. Gastritis is a condition that occurs when the lining of the stomach becomes inflamed. It can be caused by a variety of factors, including excessive alcohol consumption, prolonged use of nonsteroidal anti-inflammatory drugs, NSAIDs, and infection with the bacteria Helicobacter pylori. Symptoms of gastritis can include abdominal pain, nausea, vomiting, and a feeling of fullness. Fortunately, there are several ways to treat gastritis and alleviate its symptoms. One of the most effective ways to treat gastritis is to identify and eliminate the underlying cause. For example, if the gastritis is caused by excessive alcohol consumption, reducing or eliminating alcohol intake can help alleviate symptoms. Similarly, if the gastritis is caused by NSAIDs, switching to a different type of pain reliever or reducing the dosage can help. Another way to treat gastritis is to make dietary changes. Eating a diet that is low in fat and high in fiber can help reduce inflammation in the stomach. It is also important to avoid spicy, acidic, and fried foods, as these can aggravate the stomach lining and cause further inflammation. Instead, focus on eating lean proteins, whole grains, fruits, and vegetables. In addition to dietary changes, there are several natural remedies that can help alleviate the symptoms of gastritis. For example, drinking chamomile tea can help reduce inflammation in the stomach and promote relaxation. Ginger is another natural remedy that can help alleviate nausea and vomiting. It can be consumed in the form of tea or added to meals as a spice. Finally, medication can also be used to treat gastritis. Antacids can help neutralize stomach acid and alleviate symptoms such as heartburn and indigestion. Proton pump inhibitors, PPIs, and H2 blockers can also be used to reduce the production of stomach acid and promote healing of the stomach lining. Overall, there are several ways to treat gastritis and alleviate its symptoms. By identifying and eliminating the underlying cause, making dietary changes, using natural remedies, and taking medication as needed, it is possible to manage gastritis and improve quality of life. I hope you found this information helpful. Please consider subscribing and setting notifications for future updates.